Good afternoon, everyone, and happy lunch hour. My name is Sophie Phillips, CEO of TexProtects. Thank you for joining us today for our Early Childhood Matters webinar, in which we will be discussing a recent survey of state and local policymakers on what they know and believe works for early childhood and early childhood brain development. And so I want to see who's on the webinar with us this afternoon. And so we are going to launch a quick poll to see who is joining us today. And while you guys are completing that poll, I want to thank the Episcopal Health Foundation. This study was really their vision, and their investment in leadership in early childhood is really changing the way that Texas cares for our kids. And many of you on the call know today that Texas traditionally has not ranked very well. And currently we rank 41st out of 50 states in the way that we care for our children. So we are grateful for their time and investment. And as always, I'm thankful to our partner at Child Trends, who did this work with us as well. For those of you, I hope that you have seen the release of the survey findings from Child Trends, and so we're going to put that report in the message chat box if you haven't gotten a chance to see it yet. And then today at 1 o'clock, right after the webinar, we will be releasing our messaging report that goes alongside of that. So we are really excited. As I read through these findings and these reports, I'm just so thrilled, and there's so much promise. And I think, you know, policymakers here in Texas actually believe in a lot of those early childhood policies that many of you on the call, including ourselves, are working to change here in Texas. But it's going to take all of us if we're really going to get this done, and there's a lot more education that needs to happen. So thank you for joining with us today. So first, we are going to hear from three brilliant individuals who've been leading this work over the past year. First, you're going to hear from Dr. Jennifer Mineo, the Senior Research and Evaluation Officer at Episcopal Health Foundation, on the importance and the rationale of this work. And then next, you will hear from Dr. April Wilson, the Deputy Program Director at Child Trends, who will go over the survey results. And then finally, from Jennifer Lucy, the Managing Director of Programs and Policy at TexProtects, who will share what we learned as best messaging and policy tactics to get this work done. Before we get started today, and I pass it over to Dr. Mineo, I want to share with you the working definition of early childhood brain development and what that meant for our survey and our study here today. And so early childhood brain development is a rapid period of brain activity from the prenatal stage to age 3, in which early experiences can have lasting consequences on learning, behavior, and health due to the plasticity of the brain during this critical period of development. And so with that, I want to thank you all again for joining us this afternoon, and I'm going to turn it over to Dr. Mineo with Episcopal Health Foundation.
Thank you, Sophie. So at the Episcopal Health Foundation, our work is really guided by our strategic plan. And as part of our plan, we have 3 goals. The focus of today's webinar is on our 3rd goal, really, to build the foundation for a healthy life by investing in early childhood brain development. Under this goal, we are working through research and our grant making to support families in their homes, communities, and through the health system. And this is really our play to help children, particularly those in low income and vulnerable families, so that they can have the best chance at a healthy life. EHF is specifically focused on supporting brain building during those critical years, prenatally through age 3. You know, the science shows that there is a direct connection between early childhood brain development and lifelong social, physical, mental, and behavioral health outcomes. And repeated evaluations have shown that effective early childhood services can improve life outcomes for children, as well as generate positive financial returns on investment. So knowing this, we see that policymakers at the state and local levels have multiple mechanisms to support positive brain development for children ages 0 to 3. They can influence and facilitate related policies, programs, and public funding streams. So in order to best communicate with policymakers and advocate for positive policies and programs around early childhood brain development, we wanted to know how best to frame our messaging. In order to do this, we need to know how policymakers think about early childhood brain development and what they know about this somewhat complex topic. In order to do this and to learn about policymakers' knowledge and attitudes around early childhood brain development, EHF contracted with TexProtects and Child Trends to conduct a study to assess state and local policymakers in Texas. And the study findings and the related messaging tips are what April and Jennifer are going to share with you all today. We want this work and the messaging guide specifically to be a resource for stakeholders and advocates to support your communication about early childhood policy and program development, and of course, to benefit children ages 0 to 3 and their families. Thank you all for your interest in this topic, for your work, and for participating today. Sophie?
Thanks, Jennifer.
Or April?
Yes, thank you. Can everyone hear me? Okay, great. All right, so great. Thank you very much. Yeah, so in order to actually address the goals of the project that Jennifer just outlined, we partnered with TexProtects to survey Texas policymakers. And just before I go into those details, I want to take a quick minute to acknowledge the amazing work by the rest of the team who worked on this project at Child Trends. So Brooke Whitfield, Sydney Briggs, Beth Jordan, and Madeline Carter. And of course, we had just such a wonderful partnership with TexProtects and the Episcopal Health Foundation. So for this part of the webinar, I'm going to really focus on the findings from the research study. So I'll describe the research question, the data collection methods, the findings, and the implications and conclusion. So we had two primary research questions here. First was, what do state and local policymakers know about early childhood brain development? And then also, how do they use that information to make decisions about funding and which policies to support? So to carry out this work, we collected data in really close partnership, but through focus groups, interviews, and surveys for the study. And in general, Child Trends kind of led the development of all the protocols, including designing the survey, as well as conducting all of the interviews and analysis. And then TexProtects led all of the recruitment efforts, and then they led the focus groups. So in total, we heard from key stakeholders in 4 focus groups across the state. So that included community advocates, nonprofit leaders, parents, and others who are knowledgeable about early childhood development. And we also talked with one former and a current state legislator, a county commissioner, and then a state agency lead. And those stakeholders and policymakers provided us with such rich information, which we are truly thankful for. And so Child Trends used all that information then to create a survey for state and local policymakers. And it was an online survey that was sent to all of the Texas state legislators, as well as county representatives, mayors, and city council members in the 57 counties of the Episcopal Diocese of Texas. And so there were a total of 60 policymakers who responded to the survey. So of those 60 policymakers who responded, we had a fairly good mix by levels of government and party. So of those who responded to those questions, 45% represented local policymakers, 52% were state legislators, and then 48% identified as Democrats, 42% as Republican, and 5% as independent. Now, of course, this isn't a representative sample of all of Texas policymakers. You know, obviously, it's only a small portion of the policymakers in Texas. And of course, in Texas, there are more Republicans and more local policymakers. But that being said, we were really excited just to have such a range of voices. And of course, what most people are actually here is what did we learn from this study? So one of the things we learned is that there really are several areas of early childhood brain development concepts that policymakers understand. So most agree that good health care and having a positive relationship with a parent or a caregiver are both really important for early brain development. And we noted in the survey that health care includes things like access to comprehensive pediatric and primary care and health care for mothers during and after pregnancy, including screening for depression. And policymakers in this study also agree that children's experiences between ages 0 to 3 are important for their long-term well-being. And the policymakers in the study understand that investing in services for families and for children result in long-term social benefits. And social benefits include things like having a healthier population, decreased child abuse and neglect, and increased educational achievement. And all of these areas of agreement represent opportunities for talking with policymakers, which Jennifer Lucy will discuss more shortly. Now, of course, there were also some areas in which policymakers had less understanding or in which there was less consensus. So policymakers were less likely to understand the influence of chronic neglect, chronic stress, and trauma on early childhood brain development. And even more specifically, several of the policymakers didn't realize that the brain is physically different in young children who experience chronic neglect compared to those who don't experience that chronic neglect. And they often didn't realize that parents' chronic stress, so including situations like just regularly needing to choose between buying groceries and paying the rent, they didn't realize that that type of stress affects children's brain development. And there was also less understanding that young children's brains can recover from adverse experiences and trauma, particularly through a close relationship with a warm and responsive caregiver. And then also, while most understood that investing in services can result in long-term social benefits, there was less understanding that investments can result in long-term fiscal benefits that exceed that initial cost. And that idea was also echoed by the interviews and focus group participants who noted that something that they believe that policymakers sometimes fail to connect the dots between those investments in supports for early brain development and those long-term financial outcomes. And in this survey, we did note that fiscal benefits include things like decreases in other costs like social programs, child protective services, criminal justice system, or increased revenue through higher productivity or a larger tax base. And then policymakers were also asked to select 3 programs that they believe have the greatest return on investment for Texas. And overall, policymakers weighed healthcare for moms and children most heavily. So here in this graph, you can see that 58% mentioned healthcare for mothers during and after pregnancy through Medicaid. And 50% mentioned children's health care through Medicaid or CHIP. And we can also see that nearly half thought that early childhood programs like Head Start and Early Head Start had the greatest return on investment. And a little over a third noted the importance of food and nutrition support such as SNAP and WIC. And then policymakers in this survey also, on the other hand, they didn't value as highly the programs like child care subsidies. So that's at the bottom of that graph there. And actually no one selected that in their top 3. And so moving up from there, you can also see that a few of these policymakers selected workforce supports or home visiting programs, and then about a third included ECI services. Policymakers here were also asked to select and rank the 3 policy issues that they believe have or would have the greatest benefit for children ages 0 to 3. And so overall, policymakers in this study, they ranked most highly that access to pediatric and primary care, that's what they put as having the greatest benefit, followed by healthcare for moms during and after pregnancy, nutrition and food security, access to high quality, affordable childcare for families, and then access to mental or behavioral health care for children or for parents. And then policymakers in this study, on the other hand, ranked early and consistent developmental screenings and high quality childcare workforce as having the least benefit for young children. So you can actually see those tied at the bottom of this figure. And if you move up from that lowest ranking at the bottom, you can see that policymakers in this survey also frequently ranked lowly home visiting programs, comprehensive referral networks, and then also promoting responsible fatherhood programs. Policymakers in this study also disagreed about the role that government should play in supporting early childhood brain development. So here you can see that about 63% of the policymakers thought that government does have a role in supporting early childhood brain development. But over a third of the respondents thought that only the family has that role and the government should not play a role. And that disagreement about the role of the government echoes themes from the focus groups and interviews with stakeholders. So although stakeholders generally believe that policymakers understand the importance of family in early childhood brain development, some of the stakeholders felt that policymakers are somewhat out of touch with the challenges that families with young children face, and particularly those difficult realities for families who are living in poverty and who can't afford to stay home with their children, but they really struggle to find safe and affordable and stable childcare. And so those stakeholders felt that the government has to be involved to provide some support. And in particular, some of the stakeholders noted the challenges of accessing high quality, affordable childcare, and noted that it just can't be fully addressed without government support. Now, as you might recall, policymakers in this study didn't consider policies like childcare subsidies as being particularly valuable, at least in terms of their potential for a return on investment. But because childcare does have such a strong influence on that early brain development, and many families face challenges in accessing and affording high quality care, many of the stakeholders did note that this is really a public interest topic, so similar to public education. Now, policymakers were also asked to indicate which factors they weigh most heavily when deciding whether to support or prioritize programs or services for young children. And 70% of the policymakers in this study indicated that the evidence of effectiveness is one of the most important factors. And then policymakers also noted the importance of cost, that return on investment or net gain, the impact on long-term child outcomes such as health or productivity and educational attainment, as well as a demonstrated need for services in the community. And then policymakers also indicated what information they feel is missing that would really help them make better decisions about how to promote healthy brain development in young kids. So most of the policymakers in this study noted that they wanted more data on outcomes for young children and families in public programs. And that makes sense also when you think back to the earlier finding that policymakers highly value evidence of effectiveness when making decisions. And policymakers also wanted more data on current availability and gaps for programs, for existing programs, data on the return on investment for programs or for interventions, clear information on program funding, both how to fund it and how that funding will be used, as well as research on effective prevention and intervention services for young children and their families. And just something else to note here is that there were about 10% of the policymakers in this survey who felt that they already had all of the information that they needed. And so Jennifer's going to talk a lot more about the implications for messaging shortly, but these findings do highlight a few considerations that I just want to go ahead and draw out now. So one, I think it's easy for us to focus on differences with policymakers, but there really was a lot of consensus on several of the issues. And as I said earlier, policymakers in this study generally understand that young children need positive experiences and relationships with parents or caregivers to thrive later in life. And they recognize that critical role that healthcare plays in the health of young children and their mothers, and they see healthcare from Medicaid and CHIP as having a high return on investment. And most believe that investing in services can provide social benefits. And so if we frame new recommendations and advocacy efforts around those common beliefs, that might be a really powerful way to engage policymakers. Now, of course, the findings also point to some early childhood brain development concepts that policymakers struggle to understand, or at least understand less, such as how trauma and chronic neglect and chronic stress can hinder brain development. And so helping policymakers understand those concepts seems even more important right now as families are coping with the economic uncertainty and stress that's been brought on by COVID. And furthermore, when asked to select and rank those 3 policy issues with the greatest benefit for children ages 0 to 3, a high quality childcare workforce and early and consistent developmental screenings, those receive the lowest overall ranking. And so these may be areas where just having some easy to understand resources may be really useful to policymakers. And as stakeholders engage with policymakers, we think it also seems helpful just to keep in mind that policymakers have differing ideas about the role of policy in family life, as well as the role that policymakers play in supporting early childhood brain development. So for policymakers who believe that promoting this early brain development is the responsibility of the family and not of the government, then messages around supporting the family may resonate more strongly than messages about supporting children. There also seems to be a disconnect between the attitudes toward healthcare and the political support for many of the policies that could increase access for children and families. So policymakers in this survey agreed about the importance of healthcare. And this value actually showed up in multiple places in the survey, but Texas does currently have the highest rate of uninsured children and women in the nation. So just trying to better understand why there's that disconnect between the attitudes and the policy is something that we just think is really important to consider in future research, especially given some of those additional healthcare needs with the COVID-19 pandemic. So I think I'm going to pass it off to Jennifer now. I want to say really quickly, if you want a copy of the survey, if you want to learn more about the methods or see the full table of results for all of those survey items, just send me an email and I'll be happy to share those out.
Thank you, April. I'm Jennifer with TexProtects, and so thrilled to be with y'all today to talk about the companion report that we developed as a result of this study. And just want to reiterate my gratefulness to EHF and to Child Trends and to all of the stakeholders who participated in focus groups and policymakers who participated in our survey. I've learned so much in speaking with you and listening to you, and I'm excited to share what we've learned with you all on the webinar today. So our purpose in this study was really, this report was to take what we know from the science, what we learned from this survey, and really blend those together to deliver messaging strategies and policy recommendations that are tailor-made for Texas. Unfortunately, the science that may be very clear to all of us on this call does not speak for itself. And so translating this complex science into actionable policy really takes intentionality, thoughtfulness, knowledge of our audience, and strategy. And so I hope that what we've created here is going to be a tool to help you in your work to do that. I read a study just yesterday, and it was from 2012, but I think it's still relevant. And it said it takes approximately, on average, 17 years for a scientific discovery to move into mainstream policy and practice. That's an entire childhood. And so we know that our kids can't wait that long. And while the science is clear, when we look across our policies and our investments, we don't always see a super intentional priority placement of healthy beginnings and supported families and early care and education for our youngest children and their families. And so we think, especially with COVID, that this work is even more relevant than it has been before, and are excited to share it with you. At this point, I want to talk about a few definitions. So first of all, the intended audience for this work is advocates. And some of us, by virtue of our work or our experience, are more comfortable with that label than others. But to those of you who may not immediately identify yourself as a child advocate, I assure you that you are. If nothing else, by virtue of choosing to spend your lunch hour on a webinar titled Early Childhood Matters, I know that you're part of the team. And whether our conversations are happening at dinner tables, community gatherings, church, or with lawmakers, they matter. And being sure that our families, our communities, our funders, our providers, our lawmakers are all hearing about the importance of the early years is critical. And it takes all of those pieces to really build up toward meaningful change. So thank you for joining us and being part of this work. The other definition I wanted to talk about for a moment is just the participants in our survey. So obviously, as April described, the 60 folks who completed our survey were policymakers. But I don't think their opinions and values as reflected in this survey are that unique. I think at minimum, they likely reflect a lot of the values and priorities of their constituents. And I know for me, they reflect a lot of the values and priorities of people that I know and love and work with. And so while the intended audience for these messaging strategies is policymakers, I think that it has potential to have impact beyond that and can even influence the way we talk about these issues in ways that are powerful with our family and our friends and our coworkers. Okay, with that, let's get started. So April covered beautifully what you're going to see reflected on this slide. That largely there were two buckets of learnings: what policymakers understand and value, and what we may have, places where we may have more work to do with some of them in building more investment and prioritization. And here I want to make, or really echo, one more disclaimer. These findings are based on a subset of policymakers who participated in this survey. And every policymaker is unique. Across party, across age, across everything. And so while we're going to be working with some generalizations here, I want you to hear from me that in the work, it's really person by person, and we respect that piece of the work as well. Okay, so what we want to do is think about how to leverage these ideas on the left to build awareness and understanding of the things on the right. Because what we know is taking a piecemeal and fragmented approach is really not going to move the needle for Texas kids collaboratively. And with 1 in every 10 American kids living right here in Texas, when we move the needle for Texas kids, we're moving the needle for our country. And I think that's something that needs to be communicated regularly. So the survey results, plus the focus groups, interviews, and conversations all along the way really led us to 5 big strategies that we think can be used to effectively communicate the importance of early childhood development and the programs that support early childhood brain development to policymakers and their family and friends. Oop, I skipped too fast. So number 1 is to create outcomes-based messages. So you saw in April's slides that policymakers weighed very heavily evidence of effectiveness, cost, return on investment, and impact on long-term outcomes. And this is really, really good news for us because the ROIs for many early childhood programs are unrivaled across the social sector and unrivaled across interventions later in life. And so what you see on the screen reflected here are some of the messages that we provided in the report as examples for you that you can certainly grab and go, but I'm hoping will also just help you think about your own work and how you can take what's working in your program or what's working in your community and communicate it in this way. And at this moment, I want to say that what I would love is, as I go through these 5 messaging tactics, and you'll see some example messages on the slide, if you have other messages that you have used in your work that you feel like really resonate and might fit with some of these tactics, I'd love it if you'd share those in the chat box. This is by no means an exhaustive list, and some of you on the call have extensive experience communicating with various audiences on these topics. So just want to encourage you to collaborate with us and engage with us today and share your learnings too toward creating effective messaging. So that's number 1. Number 2 is leveraging areas of strong understanding to build awareness for topics that are less understood. And this is what I referenced at the beginning, taking those items on the left and really building on those to help people come over to understand the things on the right. And I mean, we've all heard in communication, we have to meet people where they are, right? This strategy reflects that. In teaching, or in education, we talk about it as scaffolding, starting with what our audience really knows and understands, and then slowly sort of building on that kernel, because we want to start where they are, but we don't want to leave them where they are. And so that's a really important part of the process. So for examples, in our survey, policymakers really valued healthcare and access to primary and pediatric care in those early years. It was one of the strongest findings in the study. However, their valuing of developmental screenings was quite low in this survey. And so when we think about using this strategy, we might consider how we can leverage that attachment and valuing of healthcare to help them understand the need for increased developmental screenings and referrals as a result of those screens. And so rather than sort of coming at it from an education angle, which I know a lot of us do and have done, we might consider coming at it from a healthcare angle. And perhaps there are assumptions being made about how children are accessing those screenings that aren't correct, because only 38% of kids under 2 had a developmental screen last year, according to the state of Texas babies. So we have a long way to go. And so perhaps we spend some time talking about how we can leverage those touch points in the healthcare system to really give a holistic screening of child health that really gets them connected to what they need, and how we can better support providers to do that work because it is so critical. Other examples from the survey where this strategy might apply. So policymakers reported that they valued early care and education. However, child care subsidies didn't rise to the top. And so how can we take their valuing of the care and education to help them understand how subsidies are affecting that, and bring those two things together to broaden that understanding a little bit, and perhaps broaden what they're willing to support in order to help families have access. One more example was that understanding of how positive experiences in childhood are so critical, but less understanding about the impact of negative experiences. So this is also a place where we can take that core understanding and just help make a shift toward a broader understanding. So I often talk about how growing brains are just soaking up all of the information, positive and negative, and they are looking for answers to questions about who am I? Do I matter? Am I safe? How do I survive? How do I thrive? And whether they are getting positive or negative interactions and experiences largely drives what the answers to those questions are going to be. And those answers are going to affect not just their brains, but their bodies along the way. So number 3 is choosing our words carefully. My husband, who says this with a lot of kindness, reminds me regularly that normal people often don't know what I'm talking about. So I know that's true. I know we can be prone to making assumptions that we're all on the same page about these issues and these terms. And for those of us who've been talking about some of these things for a decade or two, we might make assumptions about what people understand and what they don't. And we need to choose our words carefully. That's especially true when we are dealing with areas where the understanding is new. And this is relatively new. So as one example, the survey results, as I mentioned on the prior tactic, was that there might be room to build more understanding about how negative experiences in early life affect biology, behavior, and health. And this is a place where our words can cause a problem if we're not clear and if we're not careful. So for example, consider a few terms I know we all have heard and use often: childhood adversity, adverse childhood experiences or ACEs, trauma, and toxic stress. These terms are often used interchangeably. However, they have key differences that we need to be really thoughtful about when we decide which one to use when and to whom. After spending much of last session, and I'm looking forward to spending much of this one, talking about a bill that would require a strategic plan to prevent and mitigate the effect of adverse childhood experiences, I experienced firsthand the confusion around these terms and how the choice of one over the other could dramatically alter what my audience was thinking and how open they were to what I was saying in a particular conversation. So in our report, we've included definitions all along the way. We've also included a glossary. Again, not because we don't think you know what these terms are, but so that it can help give you a toolkit for ensuring you're being thoughtful about which you use and when, and how you define them when asked, so that we are building information and education in the field that is consistent and understandable. All right, number 4, connecting with shared values. What I love about this work, my work, is that everyone wants healthy futures for our kiddos. I've yet to have an angry meeting or a door slammed in my face when I sit down to talk about early childhood and child protection. It just doesn't happen. So this is an easy place compared to some others for us to connect with shared values. And what I know from my experience as an educator and in this work is that we have to connect with our hearts first. And only then does our head sort of come online and get ready to listen and learn and participate in a way that's productive. And so that connection at the beginning to something that is beyond statistics is really, really important. And this is particularly true in areas where there might be real disagreement. And it's also important in areas where we're trying to build brand new understanding. And I know I can be prone to pouring facts onto someone to educate them on this new domain of work. But we have to connect with, again, where they are and where their values lie. So from this survey, we learned that policymakers recognize the value of that parent-child relationship and that early investments pay off. But we may disagree on the role the government should play in that work. The Frameworks Institute, which is a fabulous resource that everyone should visit. They've done amazing work on messaging, and we have a link to them in our report as part of our resources section. They suggest using or connecting early childhood brain development to values of prosperity and ingenuity. ideas like our future success is dependent upon the health and problem-solving ability of the next generation. For me, this approach particularly takes a little bit of intentionality, because while I'm 100% on board with connecting with shared values, that isn't the particular value that motivates me to get out of bed every day and do this work. But this is about speaking the language of our audience, not singing to the choir or convincing ourselves. And so it's something that I'm learning to come by a little bit more naturally every day that I'm doing the work. All right, number 5. And this is the last, include public awareness campaigns and outreach to local officials in your strategy. So we know that in order to be effective, our approaches need to be comprehensive. And there are times when our advocacy might over-focus on state and federal officials over local and county ones. And we know there are multiple funding streams and opportunities at the local and county levels that can be hugely meaningful for this work and for these programs. There are longer lists of these opportunities in our report, but I would just mention by way of example, at the county level, there are funding mechanisms and opportunities that can be used for food and nutrition assistance, healthcare, pre-K, home visiting, prenatal screenings, child care, and immunization programs. These are huge buckets of work for our youngest families. And because of their proximity and connection to local communities and really understanding the gaps and the capacity in those communities, county and local officials are often the administrators for huge federal funding streams. And they have a surprising amount of flexibility sometimes in how those federal funding streams are used. So I encourage you to get them involved in your work and help them understand the role that they can play. Some of the best conversations I had along the way of our survey were with local and county officials who were so excited to have been included in this conversation and had so many questions and ideas about the role that they could play in really moving our state forward in this area. And that kind of work, where communities, local and county leaders, parents, voters are all on the same page and are communicating clear priorities, that trickles up. And we see state and federal decisions start to change easier when our communities are leading the way. So in our report, we did include a short list of strategies from the larger body of work. The 5 we focused on, we felt like really came out of the survey as strategies that would work based on what we saw in those survey results. But I wanted to give a quick nod to a few of these other strategies that are very much a part of how we want to do business and tips for you as well. So one is just to use simple visuals and stories to increase connection to what can be complex topics. There are a huge number of people who the word neuroscience, there's a glazing over that happens. And so anything we can do to make that knowledge more accessible, you'll hear a lot of advocates, including us, using a brain architecture analogy from frameworks to really talk about early childhood brain development. And I think that's a powerful tool. We also want to activate systems level thinking. So sometimes when we can zero in on a child, it can activate the idea that families are a bubble and that that child is influenced by their family. And it just all exists right here in this small little unit. And what we want to do is really bring that up a level and help people understand the network of supports and people that it takes to really support a family who can then support a child. And the way that the impacts to that child then come back and impact our community. We want to be positive and proactive. The science on prevalence of trauma and impact of trauma can be pretty overwhelming. And so we want to make sure that we are leading with solutions, leading with answers, and spending as much time talking about those things as the science that can be a little bit more troubling. We also want to avoid partisan language, rhetorical questions, making assumptions. Just be really clear, ask a lot of questions, be thankful for the work that they are doing, and lead with solutions and answers and hope. And the last one is just to really develop your core story of early childhood brain development and the key talking points you're going to use. So preparation is key, practice matters, and in our report we have a link to our version of the story of early childhood with some of the images and talking points that we use when we're communicating on these issues. And I'm going to quickly flip through the high level messages on that one pager now. So first of all, we know that development begins before day one. And again, on the one pager you can link to in our report, you can get a whole paragraph on each of these kind of high level messages. We also know that brains aren't just born, they're built. And you'll see in this image, again, that idea around everything it takes to build a healthy home, that families are not, nor can they do this alone. None of us do. And we shouldn't leave our families in that position. Experiences create the building blocks for brain development. And here you see that difference between the positive responses and the negative responses and how that can impact what the child is learning. We do know chronic and uncontrolled stress can disrupt what healthy development looks like, and that the impacts stretch across the lifespan, across multiple domains, both social and health. We know that investing early works now and saves money later. This is the famous Heckman equation showing the returns to human capital from early childhood investments. And then finally, that adversity and trauma do not dictate, should not dictate the future of a child. And so thinking about the ways that even when there is trauma and adversity, which in some cases might be unavoidable, that we know how to resource families well with protective factors, support that builds resiliency, so that even in the midst of things like COVID-19, even in the midst of things like a couple hurricanes, families have the support and health and well-being to continue that responsive relationship with their child that's going to make the difference for whether that event moves their trajectory on a positive course or a negative one. The last thing I wanted to mention today before we take questions is, what does this mean for policy? So policy has a huge role to play in supporting early childhood brain development, and I'm just going to spend a few moments touching on how we approached our recommendations that are in the report. So as many of you know, the upcoming legislative session is going to be unique, weird, different than any we have experienced before. So COVID has changed everything for us personally, professionally, in our communities and programs. It has also changed interim and legislative processes and the way the budget is going to work and the money that's available, and also what priorities will be for our agencies and our policymakers. But the pandemic has also really shined a light on the existing and continuing inequities in what some families have and some families do not. We know that there are families who chronically lack access to the things that it takes for them to ensure, even during hard times, that they can offer a safe and responsive environment for their young children. So our framework in thinking about what is needed for a family to do that comes down to three things. One is healthy beginnings, and this starts even before birth and includes access to comprehensive health care for mom and baby. It includes supported families. This work includes strategies to make sure families can easily and quickly access the right services and supports at the right time. And that includes services like home visiting and early childhood intervention. And then third, high quality early education and care. And of course, this includes high quality care in all its forms that are built around responsive relationships and safe environments. Many of you on the call know that with funding from the Pritzker Foundation, TexProtects, Texans Care for Children and Children at Risk have teamed up to build the Prenatal to 3 Collaborative, which currently includes over 100 organizations around the state who have worked alongside us to develop a policy agenda for the next 3 years around these 3 buckets. And that agenda, if implemented, could ensure that over 300,000 more Texas children and their families have access to these kinds of needed supports. If you'd like to learn more about that agenda and what that will look like for the upcoming few sessions, or you want to get involved as an organization, as an advocate, you can click the link in the slides, you can visit us on our website, or you're welcome to reach out to us personally. I would also note that in our report, you'll have access to a live advocacy alert where you can spend a minute or less sending a note to your local county and state officials to let them know that you think early childhood matters and asking them to prioritize investments for our youngest kids in the upcoming session. So as I close, I just want to thank you all again for joining us today. The science has really made clear the cost of leaving our families and children to deal with adversity alone. We know that with COVID, there is more adversity and stress than in many of our families than I've certainly seen in my lifetime. But the science is also making clearer than ever the evidence-based and effective paths forward to creating a safe and holistic system of care for children and their families. And we have more tools in our tool belt to prevent these adversities than we've ever had before, if we have the political will and the strategy and the coordination to make it happen. And that's needed now more than ever. So I think that's my last slide, and we will have some time for questions.
Thank you, Jennifer, and thank you all for participating today. And just thanks to Jennifer Minio, April Wilson, and Jennifer Lucy for sharing this work with us. And again, many of us have been doing this work for a long time. And yet I think every time we do this type of research, we always walk away with more learnings and ways that we can do better as advocates, and the ways that we need to educate our policymakers about the issues that really matter. And so thank you for those who have typed questions into the Q&A chat box. Some of them have been answered, but I'm going to go ahead and open up and field some of these questions to our experts today. We had a great question from one participant. Did you hear anything related to the number of kids impacted by a specific program or policy? And did that number of kids impacted impact the policymakers' support for that program? And so I think where this could be related is like policymakers generally believe that supports for moms postpartum and CHIP and Medicaid were very beneficial, but right, given the huge number of kids and moms that would be impacted by that, and knowing they value cost, you know, was there any, I don't think there was a survey question, but was there any feedback through the survey process that maybe got to that impact on number? April.
Yeah, no, it's actually a great question. It didn't come up in the focus groups either, that phrasing of it. There was the question that's related to what policymakers need, and one of those is like information on like the impact on children and families and the data on programs. Like, I think that's probably as close as you get, and that was obviously something that they did want, but no, so great.
Yeah.
A great like way of like thinking about that too.
Yeah. I know, April, you answered this question as well, but I thought it would be good for the rest to hear. You know, when arranging the survey for policymakers, and Jennifer, maybe you can take this, was it difficult to get them to participate? Did you have to offer anonymity for them to participate? And, you know, what did that look like?
Well, maybe I'll start, and then April, you can add. Yes, it was tricky. There was anonymity offered for sure. Nevertheless, from some offices, there was still a hesitancy around completing a survey, specifically that would speak to policy priorities, and perhaps even more so prior to an election. It was interesting to hear them communicate where those worries came from in some cases. We were just thankful for those who did agree to participate. And for those that did, we ended up having great conversations often, not just survey results. And so we feel like we got more than we even wanted from those that participated. And we'll be thinking about how we can address some of the obstacles we did face in people feeling worried about how this information would be used. And yeah. April, what else?
Yeah, no, I think I answered a little bit in the chat box, but I was answering it purely from a like research end that yes, we said many times the confidence, like we would keep all responses private. We, of course, you know, as a research organization, we keep all those things on like a secure drive. So, but that doesn't mean that there aren't still obstacles. And in both making policymakers feel confident about that their responses are truly private, but also just, I mean, like for anyone to actually get someone to sit down and take a survey. And then, you know, you have busy people and like, so, but TexProtects did a lot of outreach, and I think some door-to-door visits even in a pre-COVID world. So, yeah, kudos to them for getting 60. I think
that was part of the intentionality of having Child Trends partner with us, right? Because as an advocate, I could understand the hesitancy in some cases in terms of what our agenda might be for this survey. And so I do think that it was a huge benefit that we were able to say that we were really just doing outreach on behalf of Child Trends, who has such a stellar and well-known reputation for how they do their work, and that they would just be reporting back to us. And I think that that was key and would continue to be in future iterations maybe of work like this.
And I think, and that's a really good, I appreciate the kudos there too, Jennifer, but I think it's a really good point that the partnership here is really key, because having a local organization that has like those direct ties and relationships is still just essential to actually getting people to, well, because, you know, you can imagine that if, you know, we just sent out a mass email, that probably wouldn't have received the same response rate.
And as a reminder, those of you who are interested more in like the survey details and questions, go ahead and email April and she can send more of those details out to you. We have 1 minute left. Jennifer Minio, do you have any final thoughts or closings or anything that you'd like to share this afternoon with us? Again, we just thank you for the Episcopal Health leadership on this work and the investment in Texas. I think this work has already gotten a lot of buzz across the country and wanting to take the survey and replicate it in other states. So thank you for your leadership and your vision with this work, Jennifer.
No, of course, my pleasure. You guys did the work and it was fabulous, and I'm thrilled that we can share the findings and that it can be useful to other stakeholders and advocates, regardless of what advocates look like, starting back to Jennifer's presentation. But yeah, thank you all for your great work, and I do hope that it is utilized.
As a reminder, this webinar is recorded, so we will send it out and you can watch it and you can share it with your friends. And there was also some questions about whether or not we could share articles and studies related to supporting the return on investment, and also questions about some data on developmental screenings performed in Texas. So those are resources that we definitely have and can get out to this group. And so with that, thank you all. It is 1 o'clock on the dot, and we hope you have a great Thursday and that everybody stays safe and healthy.
Thank you.
Thank you.
Thank you.